Hello guys, welcome back to the channel. Today I want to talk about another frequently asked question in the clinic, and that is the subject of sinusitis, specifically bacterial sinus infection. So at least once a week, I hear a patient coming in complaining of runny nose, pressure on the side of the nose or in the forehead, with headaches, and they already come self-diagnosed with bacterial sinusitis, and they're asking for a Z-Pack, which is an antibiotic, azithromycin. When I ask them for how long have they had the symptoms, the usual answer is 2 to 3 days. Well, I had to tell them that that's not bacterial sinusitis and that they do not need antibiotics. And for the most part, the usual reaction is they get upset. And it's understandable because for many, many years, doctors have been treating allergic sinusitis or viral sinusitis with antibiotics, and it's been azithromycin, the Z-Pack. But the evidence have shown that we don't need to treat those maladies with antibiotics. And that's usually because they self-resolve in about 7 to 8 days. So my tip for you is that if you're having that sinus pressure either on the side of your nose or on the forehead, and you're having runny nose, you're having the headaches, well, that just means that there's inflammation around the tissue covering the sinuses, and all the mucus that is produced, it cannot drain properly, so it builds up, creating pressure, and you get the pain. And in order to relieve that, it's to use saline rinses followed by Flonase, and take an allergy medication like cetirizine or loratadine, which you can buy them over the counter, likewise with the Flonase, and then try that for a few days. In order for us to actually give you antibiotics, those symptoms need to be present for at least a week and need to be accompanied by fever and thick, purulent drainage through your nose, not just a runny nose. Then we can go ahead and prescribe antibiotics, because that means that the accumulation of mucus in your sinuses has persisted long enough that bacteria has grown. And then now we can call it that is a bacterial sinus infection. And the usual treatment, or the recommended treatment, I should say nowadays, is not a Z-Pack, it's amoxicillin. So keep that in mind next time you come to see us, if you're coming in for a sinus infection. So again, bacterial sinus infection, we're talking a period of 7 to 8 days minimum of sinus pressure, headaches, fevers, chills, and mucopurulent discharge. Then we can prescribe you amoxicillin or augmentin, okay? Otherwise, if it is less than that, then what you need to do is Flonase, which is the brand name for fluticasone, saline rinses, an allergy medication like cetirizine or loratadine, and you can take ibuprofen and acetaminophen for the pain and the inflammation. Got it? Well, I hope you guys have found this video helpful. And most of all, I hope that you find this video very informative. You have any questions, any comments, please don't forget to leave them down below. Till next time, bye.